I'm going to talk about Medicare's new telehealth service that was just announced to help Medicare members be more comfortable in communication with their doctors with everything that's going on with the new coronavirus. So this is really important. Stay tuned.
Medicare on video, Medicare on video.
So this is obviously a very important time, something that most of us have not seen in our lifetime, where the government is taking massive action to limit social interaction in order to stop a virus. The COVID-19, the coronavirus, it wasn't here 3 weeks ago, and now it is absolutely everywhere, and it is a global problem. So the U.S., while not as bad as so many other places, is taking action to try and limit the exposure going forward. So I'm going to go through some things, and this is certainly very important, and obviously, again, something that we have not seen before. So it's going to be a work in progress as it goes, and we need to do what we can do to make sure that we do the things necessary to limit our exposure and to limit the exposure of the ones around us. So there are some changes, and there's some big changes, and there's going to be more changes coming along. So we absolutely need to stay informed. So the first thing I would absolutely ask you to do is I've set up a Facebook group that's strictly for Medicare members where we can talk to each other and we can communicate as things come along. So I would ask you and certainly encourage you to join this Facebook group. You can find it by going to talkingmedicaregroup.com. It'll take you right there. Simply join, and then you can communicate back and forth. I'll be a big part of it, and we will discuss things as they come along. So right now, we're going to talk about what they announced yesterday, which is the new telehealth services with Medicare. First thing to understand, it's not really new. So it's actually already there, but it is set up really for people in rural areas. So people that don't have access to a lot of different services that they can utilize telehealth services. So what Medicare is going to do now is expand it to anyone. So anyone can utilize the telehealth services. And what this is designed to do is to be able to give you pretty real communication with medical professionals without having face-to-face contact. So it can be terrific. So what this does is it now allows the medical professional to be compensated by Medicare for the telehealth services, which again, in the past was not available only in rural areas. So now it's available everywhere. So when we're talking telehealth services, can be office visits. So you can Skype, and whether you Skype now or figure out how to FaceTime, it's something you may have to learn a little bit in order to use it, but Skype's actually very easy. I use Skype every day, and you can literally talk and interact with anyone from a distance without actually having to personally be there with them. So good for office visits, psychotherapy, consultations, or other medical or health services. So this is certainly a big step. It's something that I would love to use. I'd rather not get in my car and drive to the doctor's office. I'd much rather be able to use telehealth services and speak to them. And I would think, one of the positives out of this is it's going to expand this type of service where we really don't need to physically go to the doctor's office for a lot of things. That if they can see us, if you were talking to me right now and you were a doctor, you could generally figure out my symptoms and the things that I might need. And I would think as we go forward, when you buy a computer going forward, you'll likely get a keyboard, a mouse, and some medical devices. And, we already know right now Apple Watch can detect irregular heartbeats and things like that without people even knowing it. It's saved a lot of lives already. There are EKG machines that you simply put your fingers on and things of that nature. Obviously, something like a blood test would be a different scenario, but this is likely going to expand this type of service, which will make it much easier and much more time efficient for not only us, but for the medical provider. So it makes a great scenario to communicate back and forth. So it's a two-way telecommunication system. Basically, doctor on one end, you on the other end, talking to each other, describing conditions, things of that nature. And again, keeps things simple and from a distance, so both audio and visual. And this is going to be a work in progress. So they just announced this, and they're going to have improvements as they go along, they're going to figure out the best way to utilize this. And what I would say right now, what they're saying to do in order to use telecommunication with your doctor is first call your doctor and find out if they utilize it. They may not utilize it yet, and that is also something that will grow as we get better. But I would think that they will set up somewhat of a call center of doctors where you can simply call in and talk to a doctor or a registered nurse or a nurse practitioner, and that way you would not have to actually go into the office. So how to find a provider. If you wanted to do this right now, you're concerned, maybe you've got a fever, maybe you've got some upper respiratory issues and you want to talk to a doctor without having to go in, the best thing to do is to, Medicare is saying call the doctor and see if they can get you on Telecommunications System. But what I would do is Google, and that's probably the easiest thing. First, who accepts it and who does it, and maybe your local hospital. And obviously we're on a national scale here, so I'm in the Tampa area. I would likely Google Tampa General TeleHealth Services, and hopefully Google will find the doctor or the hospital in my area that already is set up for telehealth services and can be very easy to do. And again, what this new provision does, it allows them to get paid by Medicare. So there are going to be many that are going to want to do it. They'd much rather do it over having you come into the office. They'd much rather have it on telehealth services. So other forms of virtual healthcare, things you can do without actually going into the doctor's office, you can have e-visits. So again, you can simply set up where you don't have to physically go into the office. It's covered under Medicare Part B. Now, this is another scenario where there's a lot of talk about it's going to be related to the virus, no cost. So right now, if you have Medicare Part B, you have a deductible on your Medicare Part B, and then you have 20% coinsurance. If you have a Medicare supplement, that likely will cover those parts. But whether or not there's going to be a cost to Medicare or to the Medicare recipient is kind of still under advisement right now. And I would assume with the way they're talking that they're going to eliminate any copays, any coinsurance, any deductible related to the COVID-19 virus. So talk to your doctor using an online patient portal. So in other words, you can just simply be on your computer. And I understand certainly a lot of folks aren't completely computer literate. And, but now with iPads, it's really not complicated. You can download Skype and it's pretty easy to use. And there'll be other things, whether it can be FaceTime or not with a phone call. One thing they did say is that they're not going to be enforcing the HIPAA laws, which is kind of a whole different scenario. So HIPAA laws guarantee your privacy. In other words, providers have to follow all sorts of regulations to make sure that they protect your information. And we certainly want our information protected. But what it also does, it restricts access to them from talking to you unless they're in pretty much a cone of silence. So they have to be in a dedicated area with absolutely no outside interference before they can talk to you, and that's almost going to be impossible going forward. So they're going to waive the HIPAA rules so that it makes it easier to communicate with you and makes it easier for you to get the information you need without putting them in a position where they have to be concerned about regulations. So here under e-visits, you must have an established relationship with a doctor. So for e-visits, it's like when you get a doctor for the first time, they want to see you before they're going to do anything on recommendations of any type of illness. So make sure if you're going to do that, you do it ahead of time. So providers for e-visits are doctors, nurse practitioners, physician assistants. So easy, again, to do things from home. So specific circumstances for e-visits, clinical workers, psychologists, therapists, things of that nature, where it's just kind of a conversation and talking to each other without having physical medical advice like blood work or things of that nature. Virtual check-ins gives you the ability to check in, again, virtually. It's covered under Medicare Part B. Talk to your doctor using your phone. Same kind of scenario, can be used from anywhere. Must have an established relationship with a doctor. And virtual check-ins, doctor or provider responds by phone, an audio visit, or a secure text message. So again, it's just another way to communicate with your doctor without physically going in to the office. You can do it by email or you can do it by a patient portal. So that gives you pretty much the idea on how it'll function, and hopefully you can work it to the way that'll best suit you. And again, it's going to get better. So this is brand new. They're just starting to play with it, and it's going to get improved significantly as it goes. So I hope you found this information helpful, and please join the Facebook group, talkingmedicaregroup.com. It'll give us the ability to talk to each other and interact with everything that is going on now and in the future, because things are going to certainly come along. So I hope you found this helpful. Have a fantastic day.
Medicare on video, Medicare